Hi, and thank you CCDS families for joining us for this research fireside chat. We're excited to update you on the progress that has been made in 2020 and our upcoming plans. As a patient group, our mission is to enable research to ensure we ultimately have options available for treatments. For this reason, the ACD aims to bring together researchers in a collaborative CCDS research community and prevent researchers from working in silos at a slower pace. We want to provide building blocks and tools to these researchers that will get multiple groups engaged and speed up the research process. One of the ways we are doing this is by engaging with researchers to define what's critical to their future success. The three most important ways that we have found through these conversations are, first, to have a robust CCDS patient registry available to all CCDS researchers, from the lone researcher in his or her laboratory to the larger pharma groups researching CCDS. Having needed patient samples available through biobanking, and last, funding fellowships that lead to lifelong commitments to CCDS research. While 2020 has been filled with unexpected challenges, ACD and the CCDS research community have rallied. Our virtual conference in August was extremely successful and helped build many new relationships in the CCDS research field. This year, many CCDS community members have contributed to the Coriell Biobank, and more specimens are being received on a regular basis. In the first quarter of 2021, we will launch a new patient registry built to answer the questions researchers have about CCDS progression and providing the data they need to determine what a meaningful outcome is for a potential treatment. This year, we also launched our gene therapy consortium. This consortium has met quarterly, and I have been fortunate enough to attend these meetings and witness the collaboration, the guidance, and the overall generous spirit between these researchers, and we are thrilled with this success. Also in 2020, we received a CZI grant. This grant is helping build momentum. We are currently reviewing applications for fellowships at several institutions that are funded through this grant. So now, as we look to 2021 and beyond, we have built a 3-year agenda focused on building on the momentum we have going right now and what our future growth will look like. So our scientific advisor, Sangeeta Iyer, is going to share some more of those details of this plan with you next. Thank you.
Thanks, Heidi. Hi, everyone. When we started working on this a year ago, we tried to integrate the needs of our academic stakeholders, industry stakeholders, and the patient community into a research plan. We identified 3 areas that are important to achieve our goal of finding therapies for CCDS. Number 1, to increase research efforts by attracting scientists to the field of CCDS. Number 2, advance translational research efforts in gene therapy and small molecule drug discovery. Number 3, identify gaps in reagents, tools, or assays and plug them. Now, as you know, last year, the ACD community successfully raised funds for gene therapy research. The proceeds of fundraising from last year's efforts have enabled advancement of work in the labs of Dr. Baroncelli and Dr. Lipschutz. The 2 labs are engaged in gene therapy efforts in CTD and GAMT respectively. They have also reported on early learnings from their preclinical studies. By funding their research, we hope to move closer to a safe and viable gene therapy cure for our patient community. We are also in the process of funding efforts to generate an antibody against the creatine transporter. In the spirit of openly sharing reagents and resources, once generated, this tool will be made available to researchers in the CCDS community. The ACD is working with research community members to identify those who will be involved in this effort. We are also working with industry stakeholders to get updates on their progress and to understand how the ACD might effectively partner with them on our mutual journey to clinical trials. As Heidi outlined earlier, with CZI's Rare as One grant, we've been able to make headway in a number of endeavors, like increasing efforts in biobanking, setting aside funds for ACD fellowships, which will be awarded to upcoming researchers in the field, working with external partners to generate some of the tools necessary for research. But CCI's grant is time limited, and the process of therapeutic discovery is a marathon, not a sprint. This means that in order for our just seeded efforts to bear fruit, we have to continue to nurture these past these initial few years. We also need to seed more efforts in this space. Just like you diversify your investment portfolio, we too have to diversify our efforts in the translational research space to enable that final moonshot that gets us to our goal. So I encourage members of the ACD family to come together. As we get ready to close out this year and ring in the new one, help us get closer to our shared mission. Thank you. Back to you, Heidi.
Thank you, Sangeeta. So last year's Holiday Heroes fundraiser for CCDS gene therapy research raised over $50,000. And this year we are aiming to once again raise $50,000 for gene therapy and an additional $25,000 for a project Dr. Longo is working on. We hope you have a better understanding of our research plans and what we are working towards in the future. Now we would like to ask for your help. Last year, a good part of our Holiday Heroes for gene therapy funds were raised by CCDS families that created a Facebook fundraiser. When you set up your fundraiser, be sure to also share your personal connection and why raising funds is important to you. Birthday Facebook fundraisers are also very successful. Any way that you can share your story and explain to friends and family why you need their help and support is bound to make a large impact, more so than we are able to. This fall, one dad contacted the ACD to set up a custom landing page, creatineinfo.org/the name of his child, and he included this link in his Christmas cards. He asked his friends and family to please donate and explain to them that he believes that a cure will be found and that the ACD's efforts are important to him and his family. Already, we have received several donations from this outreach. Another idea is CCDS gifts. We have a new t-shirt in our online store. We also have CCDS pins that are a great gift for teachers, friends, and neighbors, and they build awareness. They come on a card that says a donation was made on your behalf, and they have some CCDS facts on the other side. We also have created a fundraising toolkit. This PDF booklet can be found on our website under the Take Action section, and it outlines a long list of ways you can help. One simple example is volunteer matching. Many tech companies provide a charitable donation in exchange for their employees' volunteer work. We have very simple ideas for how to volunteer, from wearing a CCDS t-shirt while riding a bike and spreading the word to hosting a Lift for Creatine fundraiser at your gym. The ideas and possibilities are endless. Please consider how your family might be able to help the ACD support CCDS research. Every effort matters and is greatly appreciated and helps drive us forward on our mission. If you would like to get more involved in a formal way, please contact me about joining our fundraising committee that meets monthly. And thank you again. We wish you all the best this holiday season. Bye.